My name is Kash Patel, and I'm a consultant in diabetes at Royal Devon and Exeter Hospital. And I also do academic research work looking into different types of diabetes.
So why do you think the research is so important?
Well, look, we are already doing quite a lot of new things for diabetes, but if we do, and despite of our best effort, there are many things we still haven't been able to nail down. So I think doing research, more and more research will allow us to the areas that we haven't been able to improve for people living with diabetes.
So the funding aspect for research, how do charities really play into that for you?
So if you think about just in the UK, for example, funding for diabetes is mainly really comes from Diabetes UK and charities like yourself. And this is fantastic because most of the funding streams are generic otherwise, the big ones like from government such as MRC and Wellcome Trust. The other disease have advantage of a slightly bigger charities, whereas diabetes is kind of, because it's causing so many different things, very few people are focusing on it. So having people like yourself makes it really, really exciting for researchers to directly target if we have a diabetes specific questions which other charities may not be able to support you on that.
And what are your thoughts around a day like today? So it's celebrating 25 years for the charity working in diabetes wellness as well as research. Why is that so important, you think, to bring those things together?
So I think research alone has no answer to it. Diabetes is such a complex disease that we're dealing with. It's so intertwined with your social life and the being wellness. And I've always very fascinated by the diabetes because it's not just about giving a prescription. Most of the other disease, you would just write a prescription and the job is done. Whereas diabetes actually starts after the prescription. And that makes it very unique disease, that it is not just about clinician writing a prescription and someone takes the drug. There's a lot more involved in it. So I think, that's the aspect that there is a lot of human connection to it and how you perceive things with it. And the second is a lifelongness of the disease themselves. Most of the time, unfortunately, we cannot cure it. So you have to live with it. And living with a chronic disease is very difficult. And you do need the wellness aspect, the good mind, in order to deal with such a terrible time or disease that you may have. So I think that's why the research aspect, better therapies, better understanding, along with a better self-belief, better frame of mind, I think you do need both in order for you to make a kind of, tackle it well, so you can enjoy the life and then have a disease at the same time.
So you've had delegates coming to talk to you today and you've been explaining what your research covers?
That's correct, yeah. So my research which Diabetes and Wellness Foundation funded was really a fundamental aspect of diabetes, which is we need to find the right subtype or type of diabetes when people are diagnosed with diabetes. Because the right diagnosis gives you right treatment, and it also not only that gives people a confidence and they know what they're dealing with and able to prepare them for that particular aspect of diabetes. So I think it was a very generous support, and I'm very thankful for Foundation to support on that, and actually turned out to be a really nice piece of work which has a very clinical implication on it. And we're able to find that actually it's not as easy to diagnose type 1 diabetes. We've shown about 1 in 5 type 1 diabetes, particularly the late onset one diagnosed after 30s, can be misdiagnosed. And I think that's the whole idea, that we should start using some blood tests and some new genetic tests in order for us to accurately diagnose people with diabetes is really important.
Do you have a top tip that you can pass on to delegates today?
Well, I have a one top tip. So if you are not sure what type of diabetes you have, go back and ask your doctors. Don't be afraid. I think they might give some resistance, but I think if you just say that I like to check, what do I have? And I think I must say that anyone who's got type 1 diabetes should have a positive diagnosis. What I mean is that they need to have some evidence that yes, I do have it, rather than saying I know you have it. So I think go and check it out and double check, because there is a small chance, but really small chance, it could not be type 1 diabetes, and you might be able to do something about it.